Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barela, and today's program I'm hoping will be interesting to everyone. It actually concerns Medicare. I know that for most people Medicare is not a big issue, but for those of us that are elderly, and I'm not elderly, it is a big part of our life after you turn 65, or as we'll hear today, it also is accessible to some people younger than 65. Our guest today is Kevin Waltko, owner and broker in Medicare 360, a actually consulting firm and advice firm for us here in the White Mountains. Their offices are located in the small business complex adjacent to the Village Theaters in Pinetop. And I would say thank you, Kevin, for coming in today and giving us some advice on Medicare.
Well,
I noticed the name of your company, Medicare, is not Medicare, and I understand there's some legal reasons for that, but it's Medicare 360. Would you start and tell us why you chose 360?
Sure. The reason why we chose Medicare 360 is because we deal with all the aspects of Medicare, not just the Advantage programs or not just Medicare supplements. So whatever people's needs are up here in the White Mountains, we're able to provide those benefits for them.
Essentially the whole circle
Sure.
and the whole programs. So Medicare is, for many of us, we get inundated with information come September and October of every year, and Medicare enrollment is open for...
The annual enrollment period is October 15th through December 7th of each year. So that's when the time of year when people have the opportunity to change their Advantage programs or their prescription drug programs.
So for about 9 weeks of the year, we get inundated with information. And I have to admit that it's sometimes very difficult for me to tell what my choices should be. Mm-hmm. And hopefully today you are going to let us all know about that. So let's get started, and why don't you kind of go through Medicare and give us some ideas of the choices we have to make or what the program entails.
Sure. I think a good starting point would just be to talk about Original Medicare Parts A and Original Medicare Part B. In general, people who turn 65 become eligible for Medicare's A and B. Okay. Medicare Part A is our hospital coverage. That is our inpatient care, skilled nursing, things of that nature. And that generally costs us nothing as long as we worked for 10 years or 40 quarters here in the United States. Okay.
So everybody gets
Medicare Part A at no additional cost.
And,
right.
and do you automatically get it when you turn 65, or do you actually have to sign up for it?
Well, it's a good question. If you're starting to draw on Social Security at the age of 62, yes, it will begin automatically when you turn 65. However, if you defer to the age of 65 to collect on Social Security, then you're going to want to go down to the Social Security office and go ahead and enroll into Medicare's A and B.
Okay, so those of us that become fully eligible for Medicare after the age of 65, for example, my age group was 66 and a half, mm-hmm. I actually have to sign up for Medicare when I am 65.
Yes,
okay.
That is correct. Through Social Security Administration.
Through Social Security. Does that something I have to do, or do I automatically get a notice from them?
No, that's something that you're going to have to do.
If you turn 65, is there a limitation of the timing of when you sign up for Medicare A? For example, if I turn 65 on March 1st, can I join at any time after March 1st, or do I have 30 days or so to sign up?
No, that's a good question, Tom. You're going to want to go down about 90 days in advance of your 65th birthday to the Social Security office to enroll into Medicare A and B.
So essentially a couple months before you turn 65 is when you need to make that initial contact to get into to Medicare. Okay.
Yes, because you're going to have to go through a transition period. You know, if you have Blue Cross, if you have a current health insurance program, they will not carry you beyond the age of 65. So then you'll be left without coverage whenever you become 65.
Okay.
So you're going to want to make that transition into Medicare at the
Okay.
Social Security office prior to.
All right, so that's Part A, and Part B is,
It's our doctor coverage or our medical coverage. Now there is a cost associated with that. For most people, they pay $104.90 per month for their Medicare Part B coverage. However, in 2016, this recent year, that premium went up to $121.80 for people who are newly eligible to Medicare. So we've seen a raise in the cost of Medicare Part B this year.
so that's about 20%,
It was a large increase this year, surprisingly.
surprisingly. So essentially, to get Part B is for when I go to the doctor's office, when I have outpatient tests. Does that cover that too?
It does.
Okay.
It does.
And skilled nursing facilities,
Well, that's
Part
our
A?
Medicare Part A benefit. So, I think another topic to talk about would be those deductibles that are associated with A and B. Medicare Part A has a $1,288 deductible per incident. So if I were to go into the hospital 2 times during that year, I would pay that deductible each time. However, with Medicare Part B, I have a deductible of $166. After that deductible is met, I then pay 20% of all my medical coverage for the year
Okay.
to receive services.
Okay. And so Part A essentially $1,200, $1,300 each time you go into the hospital for something that's covered under A. And then the doctor piece of that is more complicated.
It can be, and essentially it depends on how often you receive services from physicians on how complicated that could be. There are some people who turn 65, go on A and B, they're very healthy, and they decide, I'm okay with that deductible and that premium of $104.90 because I'm a healthy individual and I only go to receive services once a year and get an annual physical, and they feel comfortable with that. Other people do not feel comfortable with those premiums and those deductibles because of health conditions, maybe financial reasons. So what they'll end up doing is they'll end up selecting a Medicare Advantage program through a private insurance company that allows them to not have to pay those large deductibles. In return, what they do is they pay co-pays as they receive services throughout the year.
All right. So Part A is hospital with deductibles. Part B is office and the
Doctor
other
coverage.
sundry things with deductibles that are more complicated. And apparently there are other choices rather than just having A and B.
There is.
Okay, and we're going to talk about those later on, I assume.
Yes.
Well, the third part of that is drugs.
Well, Medicare Advantage plans offer medical coverage, and in many cases they do offer prescription drug coverage that's built into that Medicare Part C program, so we can combine our Part C and Part D benefits together. Not always, though. There are programs that are available to us that are Medicare Advantage programs that only offer Part C medical benefits.
Okay, maybe I'm not quite clear about Medicare Advantage and Part C. Part C then is
Medicare Advantage that is by law supposed to be equal to original Medicare A and B. They offer the same benefits.
and how do I get on to Medicare Advantage?
Well, what you would do is you could go to medicare.gov and look at the programs that are available to you, and then select a program based on what county you live in, whether it be Navajo County, Apache County, Gila, Coconino. They're all different programs based on what county we live in.
Okay, and so as a person, when I get my notice in the fall, how do I decide what to do?
Well, each year you're mailed a publication by Center for Medicare and Medicaid Services. It's called Medicare and You. This year it'll be Medicare and You 2017. In the back of that booklet, we'll have a list of plans that are available throughout the state of Arizona, depending on what county you live in.
Okay, and how am I supposed to negotiate that?
Well, that's where the tough part comes in. What costs are associated? What are my co-pays whenever I go to receive services, depending on what program I enroll into? Does my doctor accept that program? Does the hospital that I go to accept that program? So those are some of the things that people really need to look into before they choose a program.
Okay, so these Medicare Advantage programs then may be restrictive?
They can be, here in Navajo County, we're very fortunate with the physicians in the area that accept the Medicare Advantage programs that are available to us. Those companies have reached out to the physicians to get those contracts so that people can receive services from their physicians that they're normally used to seeing.
So essentially, I guess all the plans, Medicare Advantage plans in Navajo County are equal then in terms of provider network?
No.
Okay.
No.
So what's special about the White Mountains Medicare Advantage? I know we'll talk about it a little bit with the supplements too, but
Well, the unique part about Eastern Arizona is we are a rural area. Maricopa County, for instance, or Pima County, down in Tucson,
right,
has a plethora of programs available because there's a large population. We're not quite as fortunate here in Eastern Arizona, where programs are not moving into the area quite as much as we had hoped through the course of the last few years. So we are limited to a few choices of companies that are available here in Navajo, and even fewer in Apache County, unfortunately.
So how many are we talking about, maybe?
Two.
We only have two choices for Medicare Advantage programs in Navajo County.
Part C programs, yes, that include medical benefits, unfortunately.
That's not very many choices. No wonder they're
not.
equivalent.
It's not.
And how about Apache County?
One. Yes.
So if you want to go down the road of Medicare Advantage, which is a comprehensive, is that equivalent to like our previous healthcare insurance, like Blue Cross Blue Shield or United or anything, an all-encompassing plan?
Yes.
Okay.
Yes.
So that's essentially the narrow network that any of these other healthcare plans would have.
Right.
Okay. And well, I guess my initial thought is there are a significant number of people that have this, but that's not I guess important. Okay, so two Medicare Advantage programs here, and one in Apache County. So there clearly must be other things available to us in the system.
Sure.
And we go on.
Sure. Well, before we get into that, I had mentioned earlier that in some cases I can split up my medical benefits from my prescription benefits. And that's very important for us because depending on what medications I'm currently taking, depending on what pharmacy I choose to go to, depends on what Part D prescription plan will work best for me. So it becomes very, very important this time of year particularly to shop that Medicare prescription plan or my Part D plan.
So Part D essentially is a separate program for drugs.
It is.
And it's really important that people research this.
It is, and that is one fortunate thing that we have in Navajo and Apache County is that we are able to split up our medical benefits from our prescription benefits.
Okay.
So that is an advantage that we have over a county like Maricopa, for instance.
Okay, and if I'm a person that's on a number of drugs, are there mechanisms that help me negotiate Part D plans?
There are prescription drug calculators. Medicare.gov has a prescription drug calculator that is utilized very frequently. And then there's other various calculators that are available as well. By searching online, you can look those resources up, and you'll want to be able to type in your prescription medications, what pharmacy you would like to go to, and then it'll generally populate a list of prescription plans in the state of Arizona that are available to me. Okay. As I mentioned earlier, Part C programs are county specific, whereas Part D programs, our prescription drug coverage, are state specific. So that's where sometimes things can get a little confusing. People trying to figure out, well, is this program available to me in Navajo County? No, it's not. But Part D programs are state specific. So
all
it
right.
can get a little tricky in that segment.
It sounds really complicated. And I've been doing it for years, and it still sounds complicated. Sure. We're already almost halfway through, and my goodness, I'm already getting the idea that I really don't know what I think I knew ahead of time, and stuff. And so, Part D is a big part for a lot of us.
It's very important
for a lot of us. And so, how many Part D plans are there in our state, since our state?
Approximately 26 plans at any given time. These Part D prescription drug companies do have the ability to enter or exit states from one year to the next with the approval of Medicare. So, and we do see that every now and then where companies will come in for 1 or 2 years and then come back out of that state, and then maybe 2 years down the road they'll come back into the state. So we need to shop those Part D programs each and every year. We don't want to become complacent with our prescription drug program. And it's also very important to note that everyone about this time of year will be receiving what we call an annual notice of change. And what that annual notice of change is describing what their current prescription plan or their Medicare Part C program will entail for the following year. So you're going to want to read through that annual notice of change and see how that plan is going to differ from what you're currently experiencing.
Okay, and so it sounds like from choosing Part D plans, one of the criteria might be how stable the company has been in terms of long-term in your state.
We do want to look at that, and Medicare has done a real nice job of implementing what we call star ratings. So the star rating is set by CMS on Medicare Part C and D programs. So you'll want to see that. You know, obviously it's a 5-star rating would be the highest, 3 is an average. And there's a lot of companies out there that are receiving that average rating right now. If a program receives a 2.5 star or below rating, that member will have the ability to change during a special enrollment period to another program.
Okay. All right, I want to dwell on the last piece that this is the Medicare supplements, because with only 2 Medicare Advantage plans available to us, it sounds to me like the biggest part of it is a choice of a potential Medicare supplement. Does that make sense?
There are 12 programs available nationally across the United States. The 2010 Modernization Medicare Supplement Act is what it was referred to as. Plans A through N are the programs that are available to people across the United States. Okay, these programs are not subject to the annual enrollment period. We can change Medicare supplements anytime throughout the year because they're offered through private insurance companies.
Oh, I did not know that.
Yes, there are.
And one of these might be the ARP supplement that we get advertised so much through the AARP.
They do a very good job of that, yes.
They do a very good job. So what are the characteristics of these type of Medicare supplement plans and how they're marketed and the cost?
Right. All those programs all differ in one way or the other. Again, you can go to the Medicare and You 2017 booklet that will be coming to you in the mail, and you can look up that section of Medicare supplements to see what benefits each Medicare supplement offers. Plan F, for instance, covers all of the benefits of Medicare, or all the categories that Medicare classifies as. So, for instance, if you have a Medicare supplement Plan F, there are no copays, there are no deductibles associated with that program.
So that means the Part A hospitalization, Part B office calls, but not drugs.
Not drugs.
Not drugs. Just the A and B.
That's correct.
Okay.
That's correct.
So the Medicare supplements cover A and B, but they don't cover D.
That's correct.
Okay. All right.
Only the benefits of Medicare A and B. There's a very large number of Medicare supplements that are available to us here in the state of Arizona. Okay. They are a national program because it's associated with Medicare A and B. So I can rest assured that if I have a Medicare supplement and I happen to be on vacation or traveling abroad to another state, I can receive services in another state as long as I go see a provider or hospital that accepts Medicare.
Okay.
So that gives me a lot more flexibility with that Medicare supplement, but there's also a trade-off. There's a monthly premium associated with those programs.
Okay, so that's in addition to the 121 or whatever it is nowadays.
You will always pay that Medicare Part B premium no matter what you ever choose, whether it be to sign up for a Medicare Advantage program or a Medicare supplement. You have to have Part B to get those programs.
All right, so we have that as a standard fee, and then if we want some flexibility, we go with Medicare Advantage or a supplement.
Supplement's going to offer us the most flexibility because I know that if I have a Medicare supplement, I can go see any doctor, specialist, or hospital that accepts Medicare with my
Medicare.
Medicare supplement. The one thing that I'm really looking for with a Medicare supplement is how long has that company been doing Medicare supplements?
Okay.
What's their rating? Are they an A-rated company or are they a B-rated company? I'm going to be very particular with that decision. And then I'm going to look at the cost, because I know that if I have a Medicare supplement, Plan F for instance, all the benefits are going to be the same irregardless of what company it's offered to me by.
Okay.
So I'm going to want to find a Medicare supplement that's going to save me money at the same time. I don't want to become complacent and have the same Medicare supplement for 4, 5, 6 years down the road. I'm going to want to reshop that Medicare supplement and see if I can save some money at the same time.
So the flexibility is one issue, cost is another issue, stability of the company is another issue. And are these ratings readily available to us?
Yes, they are. The Department of Insurance through the state of Arizona publishes out annual issue of Medicare supplements that are available and what those costs are. The
Okay.
problem with that is that the companies do reserve the right to change premiums throughout the year. So that publication through the Department of Insurance does not always provide 100% accuracy.
Okay. Now, in the past, commercial insurance rates have gone up by huge numbers every year. Has the trend in Medicare supplements been the same, 20, 30% rise per year?
No, very seldomly do we ever experience that. Generally, we'll see a 5 to 8% increase with Medicare supplements each year. So, which is why I say, 3, 4, 5 years down the road on that same Medicare supplement, I don't want to become complacent. I want to go ahead and I want to reshop that and see what's available to me. Maybe a company has come into the state of Arizona this past year that's very competitive.
Well, it sounds like that's a very difficult thing. I want to also, I know we're going to talk, we have some more time to talk about supplements, but I really want to talk about another significant piece of the Medicare puzzle, and that's there are people under 65 on Medicare.
That's correct.
And the rules are different.
Well, they are. Those folks who are under 65 and on Medicare A and B are not eligible for Medicare supplements in the state of Arizona. They are restricted only to Medicare Advantage programs.
And how many Medicare Advantage programs are available?
Well, 2. Once again, here in
same
Navajo
2?
County, yes. So they're eligible for the same programs, same benefits. There's no difference. They still pay that Medicare Part B premium. And whether it be someone who had gotten injured at work, they become eligible for Social Security disability. 2 years down the road, on the 25th month, they will become eligible for Medicare's A and B. Okay. Sometimes children are born with disabilities. They become eligible for Medicare. There's Lou Gehrig's disease is another issue.
So essentially, one of the classifications is people that are on Social Security disability frequently, I guess all the time, are eligible if they've been on disability for a prolonged period of time and do the 6-month qualification. Is it 6 months that qualifies them on disability to get Medicare?
Well, once they become eligible for Social Security disability, on the 25th month that they've collected on disability, then they become eligible for Medicare's A and B.
And you just said that, and I obviously didn't pick up on that and stuff. So they're really restrictive. Now, there's no Medicare Part D because that's the comprehensive program. The Medicare Advantage program is comprehensive.
Well, if I'm under 65, I'm still eligible for Medicare's Part D as well. Because generally, if I'm collecting Social Security disability, there is an ailment or there's a reason why I'm collecting that. I've become injured. I may be taking a prescription medicine. So that's obviously an available benefit to people under 65 is Medicare Part D.
Okay, all right. So, in terms of Medicare, why is it so difficult for us to get through it all?
Well, there are some minor changes each and every year that Medicare implements for various reasons. And in that same publication, the Medicare and You magazine that's put out, in the front of that booklet, we'll explain those changes each year that we're looking out for. So, and it's not difficult. And I know that's a relative term, but it doesn't have to be difficult. Go to Medicare.gov, see what's available to you, find someone who is knowledgeable with Medicare, who knows about it, maybe a neighbor who's been on programs, find out if they're satisfied with the program that they're currently on. So there's a lot of ways that people, find out about the programs that are available to them and if they're happy with them. So.
Well, I know, and that's part of what you do. I mean, and I know there are others like you around. Your office is readily available, but it sounds to me like it's more complex than just going to medicare.gov. It sounds like it. And is there any anticipation of what might be coming down the road for us this year as we begin to see open enrollment? We're almost at October of 2017. I know that the final things don't come out until October 1st, and we're taping here a few days before that. But I have been reading about the anticipation in the literature about what might be coming down as for changes in 2017.
Right, and October 1st is that magic date that we're really looking at. That's when the companies are able to release all of their information on what's available to us for 2017. So we can go to medicare.gov on October 1st, not a day before, to find out what information is available to us. So.
Okay.
One other thing, Tom, that I'd like to talk about is, many people under the age of 65 that are on Medicare also experience financial challenge, and they're, utilizing the state Medicaid program, which we refer to as Access. So if those people have access as well as Medicare, they're eligible for what we call special need programs, okay? And those give us some additional benefits that we can take advantage of, like dental, vision, and hearing.
Okay, well, we aren't going to have time to talk about that because we're almost out of time here. It's surprising how quick it goes.
It does go
around
quick.
Here. And we do need to close, and I thank all of our listeners for watching for us today. As you can see, it's more complicated than just going to the internet sometimes, and we've had an expert here, Kevin Waltko, who is one of our local resources at Medicare 360, and I encourage you to use extra resources to help you guide you through the Medicare abyss. And thank you for watching.